The following presentation is a student presentation using a hypothetical scenario for educational purposes. The presenter is a student at UAMS, not a representative of the agency named in the following slides. The information contained herein does not necessarily reflect the views of said agency. Good afternoon, everyone. My name is Mara Moore, and I am an environmental health specialist here at Insuto Memorial Hospital. I am here to talk to you, our new radiation technologists, about the risks of ionizing radiation as part of your job here. I want to start out with a quick outline of what I will cover in this presentation. First, I will talk about what ionizing radiation is, then the differences between natural and man-made radiation. I will also cover what equipment emits ionizing radiation and specifically what equipment you will be working with, the acute effects of radiation as well as the chronic effects of radiation, how much radiation is harmful, how to limit your exposure to radiation, and how pregnancy may affect your job as a radiation tech. What exactly is ionizing radiation? Though I'm sure you're plenty familiar with radiation from your schooling, I just want to take a moment to do a brief review just to refresh your memory. Radiation is energy that is emitted from a specific source. And ionizing radiation is high energy radiation that has enough energy to remove tightly bound electrons. You can see that a higher energy ionizing radiation is over here on the right of this electromagnetic spectrum. This high energy ionizing radiation is used in medicine to create high quality images that helps physicians in diagnosing as well as in cancer therapy. However, exposure to ionizing radiation has also been found to increase risk of malignancy. Ionizing radiation comes from both natural and man-made sources. Natural sources include cosmic, terrestrial, and internal sources. Cosmic sources include the sun and stars. Terrestrial sources include the earth and organic matter. And internal radiation is the radiation that comes from everyone. Man-made radiation can be from medical sources, consumer products such as TVs, smoke detectors, and tobacco, or, to a much more minor extent, people may be exposed to radiation due to nuclear fuel sources. As a major part of your job as a radiation technologist, you will work closely with radiologists to position patients and produce a high quality image for use in diagnostics. As part of your job, you will be working closely with several pieces of equipment that do emit ionizing radiation. These pieces of equipment include X-ray machines, computed tomography scans, also known as CT or CAT scans, and PET scans, also known as positive emission tomography scans. You may note that MRIs, also known as magnetic resonance imaging, do not emit ionizing radiation. There are multiple ways to break down the types of effects that may occur due to radiation exposure. The major ones are deterministic versus stochastic, and acute versus chronic. Deterministic effects have a threshold dose below which there is no effect. In other words, these effects do not occur unless you are exposed to a certain level of radiation. These typically only occur in cases of acute exposure to high levels of radiation, an event which is unlikely as a radiation tech. Conversely, stochastic radiation effects do not have a threshold and can occur with even chronic low levels of ionizing radiation exposure. Though acute radiation effects are unlikely in your job, I do want to take a moment to briefly discuss the dangers of exposure to high levels of ionizing radiation. These effects can take weeks to show themselves and are drastically different based on the dose. At low doses, there are short term effects on blood chemistry, such as the blood cell count, structure, and function. There can be birth defects, temporary sterility, or even detectable lens opacities, and when those can affect your vision, those are called cataracts. At higher doses, cutaneous radiation injury can occur, or even acute radiation syndrome. Cutaneous radiation injury occurs whenever there are more than 2 grays to the skin, and it occurs within a few hours or several days or even weeks after original injury. Symptoms include itchiness, tingling, redness, and swelling. Acute radiation syndrome is when you receive more than 70 gray to all or most of the body. This collection of symptoms affects the GI tract, bone marrow, cardiovascular system, and central nervous system. However, these types of injuries occur only at very, very high doses, such as those endured during catastrophic radiation events, such as the Chernobyl nuclear power plant disaster. Though many tend to think of these dramatic injuries when they think of what radiation can do, these types of effects are extremely unlikely to occur in a hospital setting. However, it's important to remember that the chronic effects of radiation are still of concern as a radiation tech. These effects are caused by repeated exposure to low levels of ionizing radiation, and unfortunately, these health effects do not have a threshold under which they do not occur. That means that the risk is there no matter how low the level of exposure. This is why these risks are more likely in hospital settings, as radiation exposure is almost exclusively under the threshold level for deterministic health effects. Cancer risk has unfortunately been found to have a linear relationship with radiation exposure, even at low doses, reinforcing that there is risk at any dose, and the best form of protection is to prevent and reduce exposure. To sum up my previous points on the risk of radiation exposure, any dose confers a risk of cancer, and this increases with more exposures. However, the levels that you may be exposed to in the hospital are very low. For context, the levels listed earlier for acute effects were anywhere from zero point 0.5 to 70 gray. The annual dose limit for radiation set by OSHA is 5 rem. Though you can't directly convert rem to gray because rem measures the effective dose accounting for medical effects, for ionizing radiation such as X-rays and gamma rays, 5 rem is roughly 0.005 gray. This is all just to reiterate that it is very, very unlikely to receive acute radiation injuries as a radiation tech, though you still need to be cautious about chronic exposure. Some of you may be wondering about how your job may be affected if you were to become pregnant. Though this is a natural concern, research has shown that the level of radiation exposure as a radiation tech is below the recommended dose limit for a mother's abdomen during the term of the pregnancy. Therefore, there is generally no reason to alter a radiation tech's duties during the term of their pregnancy, and you should be confident that you are not putting your baby at risk on the job. Now that we have discussed the dangers of radiation and how you should worry about your chronic radiation exposure, You may be wondering what you can do to limit that exposure. There are many measures put in place to limit your exposure to ionizing radiation. One of the most important is to always wear your radiation dosimeter, commonly called a film badge. These devices monitor your personal exposure to keep you under the level considered minimal risk. You should also do your best to minimize unnecessary time spent in areas of elevated radiation, such as close to the equipment that emits ionizing radiation, such as X ray machines or CT machines. You should also always maximize the distance between you and the source of the radiation. Another extremely important measure put in place is the use of proper shielding. This includes the use of lead vests and thyroid collars, as well as structural shielding such as walls put between you as technicians and the machines emitting radiation. And of course, you must always follow the guidelines laid out by your supervisors to keep you safe and your risks minimized. These are the references used for the presentation. I will now take any questions you might have.